Good morning, everyone. Thank you for joining us today. Today's session is an informational webinar to talk about NIHB's newly released electronic case reporting roadmap for tribes and tribal epidemiology centers. We're really excited about this resource. So thank you all for joining us today as we talk about this resource and what we hope you will gain from it. I do want to note that this session is part of NIHB's Tribal Public Health Data Modernization Learning Community Series. So if you are not already signed up for that series, I definitely encourage you to go on our website and sign up so that you are able to get messages about any other upcoming webinars and any other related data modernization resources. We do share quite a lot out through that network. Please note that this meeting is being recorded. If you do not consent to being recorded, you are asked to drop off the meeting at this time. Thank you for your understanding and cooperation. I am going to give everyone 20 seconds just to drop off if they are not comfortable being on this call. And just some general standard protocols for webinars. We just ask that you keep your phones and mics on mute anytime you are not speaking. And please save your questions until the question and answer portion, but please feel free at any time to use the chat box or the phone line for questions. We will try to answer questions as we go, and we'll get to any questions that we do not get to during the presentation during the question and answer portion. All right, so now we'll do some introductions. We'll introduce ourselves first, and then we do have some partners on the line. So my name is Sarah Price. I'm the Associate Director for Public Health Policy and Programs at the National Indian Health Board. I've been with the National Indian Health Board for about 7 years now, and I've worked mostly on our infrastructure and infectious disease projects. And for the last couple of years, I've been very fortunate to get to work in partnership with CDC on a lot of our data modernization initiatives.
Hello, everyone. I'm Sophie Sembajwe, project lead at the Public Health Policy and Programs at the National Indian Health Board, or NIHB. I have been there about a year, and I'm really excited about a lot of the eCR projects and the data modernization efforts that we have completed and are planning for the coming several years. Thanks so much, and looking forward to this session with all of you.
And I also want to mention a couple of our partners that may join us, especially for the question and answer component of this. Sarah Sabonia with the Centers for Disease Control and Prevention is our direct partner in all of our eCR work. And we're very grateful to CDC for supporting the project to create this eCR roadmap. So you may hear a little bit from Sarah towards the end. And then we also have 2 members of APHL here to support us. That's the Association of Public Health Laboratories. So Jessica Achaya and Travis Kushner. So thank you for joining us, and you may hear from them a little bit at the end as well. And then for those of you who are not familiar with the National Indian Health Board, we are an organization that was established by the tribes as an advocate to make sure that the voice of the tribes is being heard at the national level. We seek to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being for our people. We're really excited that we feel this roadmap really achieves tribal data sovereignty and helps support that role. So we are excited for how this ties into our mission statement. And then this is specifically a project of our public health department. So our vision statement is working together to empower sovereign tribal nations to improve equity, policy, and public health systems that build thriving Native communities now and for the next 7 generations. So the purpose of this webinar today is to introduce everyone to the new eCR electronic case reporting roadmap for tribes and tribal epidemiology centers, and in general to give a little background about eCR as a public health surveillance tool that tribes can use to forward their data sovereignty. So some background on the roadmap. NIHB's efforts, data modernization, have kind of culminated in this effort to create this resource. So previously, we've worked closely with our national partners to increase understanding and support tribal data sovereignty, and we've provided direct funding to Tribes and TECs for pilot projects to increase access to eCR for disease surveillance, and this was all done in partnership with CDC. We funded 3 tribes and 1 tribal epidemiology center. We'll talk a little more about their work in a few minutes, but their work was really vital to understanding how eCR can be used for tribes, and they have been huge partners in this work. Our data modernization and eCR efforts have also included doing evaluations of their implementation activities through key informant interviews, which culminated in this development of the roadmap as a guide for tribes and TECs to implement eCR. So I do really want to acknowledge the important role that those early implementers played. So I'm going to just acknowledge the Turtle Mountain Band of Chippewa Indians, the Salt River Pima Maricopa Indian Community, Tule River Health Center, and the Great Plains Tribal Epidemiology Center. All these organizations were really trailblazers in eCR, and they really set the foundation for more tribal organizations to connect directly and indirectly to eCR data. Through their exploration of this process, they faced many hurdles as the first to go through this process, and ultimately were successful in securing eCR data directly and or indirectly based on the organization. So we really were grateful to all of the support they gave us in developing this roadmap, and we hope it will be easier going forward for any future tribes and TECs that want to undergo this process. So the goals of the eCR roadmap and for tribes and TECs are to make eCR connections more accessible for tribes and TECs by outlining clear steps to achieving a connection, outlining the challenges that tribes and TECs might face in connecting to eCR, and then sharing resources and best practices that our pilot implementers have used to overcome these challenges, and providing resources and languages that tribes and TECs can use to advocate for the legal right to access public health data. I want to note that the roadmap is not only for those who are ready to implement today. This document is meant to serve several purposes. So it's meant to give you the information you need to understand eCR and how it might look for a tribe or TEC. It's meant to help you determine if a direct eCR connection is the right step for your tribal organization. It's supposed to also help you and provide support in evaluating your capacity building needs prior to starting the implementation process. And finally, we hope that it will confidently allow you to develop a plan for implementation if you do choose that that is your best path forward. So we're going to give you an overview of some of the key content of the roadmap to help you navigate this document. It is a very long document, but it can be broken down into pieces and used to determine how eCR works, if it's right for you, and what steps you should follow to prepare for and implement eCR. And it will also break down some of those key challenges and opportunities and provide you with suggested resources for engaging in the process. So this is our table of contents. So it starts with a section about understanding eCR, and this section is for you if you want to understand the background, the history, and current implementation practices related to public health data flow in relation to tribes and TECs. It'll discuss how eCR itself works, some of the components of eCR that you'll need to understand before connecting, how eCR works with and differs from some other disease reporting mechanisms such as electronic lab reporting. We then get to the implementation component of the report, mapping the eCR process. This is really the implementation guide component of the roadmap. It takes you step by step through the process of determining if a direct eCR connection is right for you, planning to address the underlying factors necessary for pursuing an eCR implementation process, and then finally, once you've made it through all of the planning phase, the steps that you need to successfully connect to eCR for public health. Then we go to the lessons learned section, and this section is meant to share key insights learned by the pilot implementers and how you might address some common challenges and achieve success as you navigate the process. Many of these challenges and successes were tribally specific. So this section is really the first area where we've kind of gathered all that information for how tribes might have a different experience with eCR and the eCR implementation process than states and locals who may have been doing this for longer. Also in this report is a supplement on tribal public health authority. This section is meant to give you language to understand how tribes are public health authorities legally and how this legal status relates to data sharing in eCR specifically. So this is a great section to use if you're building up internal knowledge with your leadership about why your tribe may want to connect to eCR and what your legal status as a public health authority means. It also might be a great resource for educating partners who may not know as much about tribal public health authority status and tribal data sovereignty. So if you're working with states and locals, you can refer them to this section. We also have several appendices meant to provide resources, including details on lessons learned by our partners. That's where we've summarized many of the key informant interviews so you can really hear in their own words what happened during their eCR implementation process and how you can learn from that. We also have sample laws and ordinances related to disease surveillance so that you can use those as templates, resources, or as guides. We also have more resources for learning about eCR outside of the roadmap. We have suggested models for assessing your eCR readiness. and an actual work plan that you can input your own timeline so that you have a guide for how to set up your implementation activities. And I'm going to now take you through a couple of these sections and just review some of the information that is in them. So to understand eCR, you do need to understand data flow and reportable conditions and how that is used by public health. So tribes and their designated partners, such as TECs or tribal health systems, as public health authorities, do have the right to designate certain conditions as reportable according to interest and need. This is similar to states and at times in locals and territories. So tribes have the same rights to decide which conditions are reportable under which circumstances. Generally, these diseases are those of public health concern. So collecting this data can be used for case investigations, contact tracing, preventing outbreaks, providing prophylaxis or vaccines in the case of an outbreak, educating the public, and in rare cases, maybe using isolation or quarantine powers. CDC also designates 120 national notifiable diseases. These are voluntary submitted by public health authorities. So this is something that can be voluntary submitted. Unlike case reporting, this is de-identified data. CDC generally doesn't require that reporting, but it may require reporting in certain circumstances, such as when they fund a program. And many organizations do just choose to voluntarily report in terms of supporting public health. Tribes have historically not been including in surveillance efforts, nor have the TECs, but this is really shifting as there's a better understanding of public health authority nationwide. So while states have been the de facto holders of public health data, there's been a lot of progress, and eCR is a really promising way to continue and expand on that progress. So a very simple form of how eCR works. Generally, when a patient is diagnosed with a reportable condition such as measles, that case is then sent to a healthcare provider. The healthcare provider will enter the patient's information into an electronic health record. So they may enter the lab information, they may enter symptoms and suspected diagnosis. If any of the information they enter triggers a report, the data in the EHR will automatically send that case report to the appropriate public health agencies. It will look to see if it meets the reportability criteria of those public health agencies. So something may meet the guidelines for a tribe, but not the state, or vice versa, because every public health authority sets their own guidelines of reportability criteria. The public health agency would receive the case report in real time, and a response about reportability will be sent back to the provider. And then after investigating and verifying the case, public health agencies would reach out to a patient, and this is where you do the activities such as contact tracing, prevention activities, education. So that's really where you get into how you would use the data. This eCR data really fixes a disjointed system of reporting. So historical reporting relied a lot on provider knowledge of reportable conditions. It involved multiple systems. So providers might provide information through electronic, fax, email, phone, mail, other siloed methods, and it might differ by jurisdiction as well. eCR really streamlines this because reporting is automatic and it's determined by zip code. There are alternatives proposed to the zip code because of some of the challenges with overlap in jurisdictions, particularly in tribes, but right now zip code is the way that data is reported automatically. So if a case is within your zip code and you're set up on eCR, you will receive it in real time. There's two major components of the eCR system that tribes will need to work with if outside of your own electronic health record, data stores, and surveillance systems. So AIMS is a secure platform that routes messages, including eCR data. So when a condition triggers a report in a provider's electronic health record, this would trigger an initial case report in that AIMS platform. If this report meets the jurisdictional reporting requirements, as we discussed, then it will move on to that platform. Those jurisdictional reporting requirements are stored in another system, the RCKMS system. This is a knowledge repository where the data will be compared against the systems that the health organization has already selected and authored for. This is where you will actually author for conditions and decide basically what your reporting criteria is. So the public health authority will do this, and the system will interface with the AIMS platform. So, and these systems will work together to make sure the data is exchanged. All of this is secure, cloud-based, and it really, you would have to connect on the public health and healthcare agency to connect, but it does allow for interoperability across systems. And then just to demonstrate what this looks like, so the provider's electronic health record, sends over I'm going to have to pronounce this, electronic initial case report, eICR. There's a lot of acronyms in case reporting. This will go to the decision support system, the RCKMS. It will interact with what has been authored for, and then if it meets that reporting criteria, it will go as a reportability report and also as an eICR to the public health agency. It will actually go to up to 2 public health agencies in this scenario. So it will go where the care was provided and also where the patient resides. So the provider will have both of that information. You may, if you're a public health authority and you have a patient who seeks care off of your tribal boundaries, you would still get this report in this scenario because it would go both to the authority where the case was, where the care was provided, and would also go where the patient resided. So if they reside within the tribal boundaries, you would also get that report. You should note that that healthcare providers are a really important component of this. So electronic health records must be set up to report into AIMS, or conditions will not go through this system. Tribes and TECs who are considering connecting to eCR on the public health side should consider this and how they may want to work with healthcare providers that would likely be seeing patients that are tribal citizens. EHRs that are not compatible may also use the FHIR app. So there are some options, but it is important to build those partnerships across public health and healthcare, or else there won't be data actually going into the system, even if the data is coming out. So one of the main goals of this roadmap was to provide a clear map of the eCR process. So it's important to know this is our overall map, but the eCR process may not be linear. So that's kind of why we did this windy road, is to indicate these steps are not always going to happen at the same time in the same order. They may be interchangeable, they may occur out of order, they may happen at the same time. Based on your existing capacity and IT capabilities, you may adjust this. However, these are generally the steps you should follow, and it's a really good guideline for how to think about your timeline. So that is why we have these steps in this order, but we want you to take that order with a grain of salt as you're thinking about this process. So the first step is contemplating your eCR connection. So this is where you're deciding, is this even something you want to pursue? And when we're talking about this eCR connection, we're talking about a direct eCR connection. So this is where you're directly connected to the AIMS platform. A direct connection is not the only way to receive eCR data, so you should consider if that's the right way. There might be the option for you to get that same data through sharing agreements or through partnerships. So that is something to think about as you're contemplating. Some of the other things you might want to contemplate is considering why eCR data may or may not add to your public health capacity. For example, if you do struggle to get data, eCR can be really beneficial in filling that gap. You also would need to consider your capacity to connect to eCR. There's significant investment in IT, funding, legal support, and evaluation of your capacity to store and act on data. So you may want to consider how many cases you would be expecting and what the burden would be and how your capacity might currently measure and may measure in the future towards that. Tribes may also want to consider your capacity to act on the data. So if you're receiving the data but you're not able to take action, you may want to consider some alternatives. Finally, there are some alternatives, including relying on partners. So you can work with your state or local health departments and receive eCR data indirectly through a data sharing agreement. Some tribes have actually had success in receiving the data even in real time, or even directly connecting to state or local surveillance systems. So if you actually go into the roadmap document, it will actually, the NIHB will provide you some suggestions for evaluating your current capacity using the community readiness model. If you do want to proceed with a direct connection, this evaluation can help you to determine some of the underlying factors that you may need to do improvements on prior to actually pursuing the eCR implementation process. And this really includes leadership support, staff buy-in, sustainable funding, partnerships, and other capacity measures. So in the planning phase, that's where you'll address all of those areas that you've just evaluated. So you've evaluated your capacity and you'll review through these areas to see what do you need to work on before you were going to be successful in implementing eCR. This includes potential needs related to your government body's approval. There are times where having laws, ordinances, codes, policies, or resolutions related to disease reporting are required by your tribe. So you'll need to talk to your leadership and find out what you need if you're going to be doing this. We also have some guidance for funding sustainability within the report, including certain funding opportunities. NIHB actually has an eCR funding opportunity that's open that we'll share with you at the very end of this presentation. There's other expected upcoming opportunities, such as the National Network of Public Health Institutes, New Data Modernization Implementation Center. CDC regularly has opportunities, so we list quite a lot of those out. You also will need to think about your staffing needs and some potential support for building the staffing. So we list quite a few of those support and the resources that tribes have used, such as CDC's Foundation's Workforce Acceleration Initiative, where they actually place data modernization experts within the tribe for periods of time. There's also CDC's Public Health Associate Program, and there's several other examples of how you may want to fund positions or find support for positions in this document. You'll also need to think about your IT capacity, your legal support, key partnerships for being successful, and then plans for how you'll actually store and use the data once it's received, what your capacity currently is and would need to be to store it, how you'd use it. So there's quite a lot to think about before you enter the implementation stage. But with that, I am going to turn it over to Sophie to talk about, now that you've considered all of the backgrounds, all of the background pieces, what do you need to do to actually implement a direct connection to eCR?
So we are going to dive into the step-by-step guide for implementing a direct connection to eCR. As Sarah beautifully presented some of the planning and contemplation around eCR, this part is going to be focused on the eCR implementation steps. We have 7 steps that we've delineated in the eCR roadmap. However, we just want to give a word of caution that these steps are not meant to refer to a linear process. A lot of these steps can happen in tandem with one another, and some may happen in some cases before or after the steps that we're going to discuss today. So just keep that in mind. Next slide. So step 1 is dealing with public health authority designation. To get set up directly with eCR, it's necessary to determine public health authority designation for the entity that will be implementing eCR on behalf of the tribe. In some cases, this may be a tribal public health department, and in other cases, there may be a healthcare organization attached to the tribe that is tasked with implementing eCR. So with all those considerations, going through the necessary protocol, whether that be tribal resolution and agreements with a tribal entity or organization in order to designate that public health authority to implement eCR will be necessary. It's important to note that tribes are inherent public health authorities, and they do have that authority to send and receive public health and healthcare data. And TECs are granted by Congress the public health authority through the federal government to carry out public health and disease control activities to support and in consultation with tribes. So there is a slight difference between the public health authority designation between TECs and tribes, but they are both public health authorities. Next slide. So this just goes in further into just the similarities and differences between tribes as tribal public health authorities versus tribal epidemiology centers, which many of you may already be aware of. For detailed information on public health authority as it relates to tribes and TECs, we do have a supplement in the eCR roadmap. It's supplement 1, Understanding Tribal Public Health Authority. This is one of several supplements that we have in the eCR roadmap just to increase understanding of any of the concepts related to eCR or Tribal Public Health Authority and several others. Next slide. So step 2, this is the initiation of the eCR process with CDC. We do have one or two of our CDC partners here who have been great partners with us in all the work we've been doing around eCR and data modernization. So the first step within step 2 would be communicating with the eCR coordination team at CDC about the plans, your plans for implementing eCR. And the team can be reached through the ecr@cdc.gov email. And at this point, during the initiation phase, you would designate specific staff within the tribal organization or whoever is tasked with the eCR implementation to securely access the AIMS platform that Sarah had mentioned earlier in the presentation. This platform will be essential to connecting through eCR, and it is managed by the Association for Public Health Laboratories. Next slide. So moving to step 3, this is going into the actual connection to the AIMS platform, which would require SFTP or S3 protocols, which are secure protocols that will enable a secure connection to the AIMS platform to send and receive data. So for this step, APHL will be a key partner on this. They will be orchestrating, that connection with you on the external side. But internally, tribes, TECs, tribal entities would need assistance from their internal IT departments, or however IT works. If you have a contracting agreement with an organization, however that looks like for you. But IT and in some cases, data staff, epidemiologists, informatics will be involved. Next slide. So moving to step 4, this is about the development of reportable conditions, rules, and guidelines. This step is mainly focusing on the framework that the tribal entity or organization will be using to dictate the conditions, the reportable conditions they will be receiving through eCR. So administered, I'm so sorry, tribal entities that are connecting through AIMS will need to have criteria laid out based on the conditions, reportable conditions in the area, what conditions are of concern for them, and in a lot of cases, capacity of the organization, the tribe, that will have to be taken into consideration. What capacity do you have once data is received to take action on any conditions, cases that require follow-up, that may need contact tracing, partner services in the case of STIs, depending on what your tribal jurisdiction wants to move forward with in terms of cases and conditions. So all of those need to be taken into consideration, and the rules and guidelines for reporting should be set up, made public to healthcare organizations that will be providing that information to your tribe or tribal organization. And it will be key to have open communication with healthcare organizations about what the reporting requirements are, what they should be required to send through eCR, and all the protocols around that. Next slide. So step 5 takes it a bit further. Just after looking at the framework of the reporting guidelines that the organization is going to use, RCKMS, which Sarah had referred to earlier, which is led by the CSTE. RCKMS is a knowledge management system housed on the AIMS platform. And it consists of 3 components: the authoring interface, the knowledge repository, and the decision support service. And it serves as a way of enabling public health authorities to input, edit, and manage case reporting criteria in their jurisdictions. So the authoring process is very key in this eCR implementation process, and criteria needs to be clearly delineated in the system. And next slide, Sarah. And there are 3 components involved in the connecting to the RCKMS system. So connecting with CSTE, the staff dealing with the RCKMS platform will be necessary to begin the process of authoring in RCKMS. Followed by that, or in tandem, public health authorities would need to determine jurisdictional and reporting criteria for reporting in RCKMS. And so something that I really wanted to emphasize is a lot of these platforms are governed by the zip code criteria of selecting jurisdictions, which in some cases can pose some challenges for tribal regions and territories that are not clearly clearly defined by zip codes. There may be partial zip codes that apply, shared zip codes. So this area is definitely something for careful consideration when selecting the geographical criteria that will be necessary for your eCR, the eCR data you'll be receiving. Finally, determining the criteria for reportable cases and conditions, which we discussed in step 4. This is where it will, the criteria that you have established will be kind of operationalized in RCKMS. You will be given, of course, training on using the platform and how to input the criteria that's specific to your jurisdiction. Next slide. So step 6, this involves establishing an in-production live connection to AIMS. So basically after the previous steps 1 through 5 in the eCR implementation process are completed, if everything is aligned, the Tribal Public Health Authority can proceed from the test environment to a live in production connection to AIMS. And once connected to AIMS, the Tribal Public Health Authority can begin receiving real-time reports from healthcare providers participating in the eCR, eCR data exchange within their specified jurisdiction. Next slide. So finally, the 7th step is putting data into action and sustaining eCR. This is really why we're doing all of this, to get the public health data and put it into action for public health purposes, and to benefit the health of tribal citizens, and putting this data into action and sustaining eCR are really important aspects to consider. In terms of sustaining eCR, you would want to be able to ensure that you do have the capacity moving forward beyond whatever funding you may have, if it is temporary funding sources, are there like means of getting more long-term funding for things like surveillance systems, if that's something that your public health authority would need, staffing issues. Those are things to think about. If staff are only contracted for the period of implementation of eCR, what would sustaining those systems look like, as well as thinking about analyzing the data, where's the data going to be stored, all those types of things, as well as partnerships perhaps with um, local, state organizations or health departments in the area to assist with activities around eCR and disease investigation and so forth. And communication with healthcare organizations in the area and continual partnerships with eCR and public health activities will be essential. Next slide. So I did somewhat talk about some of the things to consider for sustainability of eCR moving forward. And with that, I was able to talk about some of the challenges, which include funding. A lot of times limited funding can be an issue, ensuring funding sources are sustainable for eCR implementation and um, sustaining the infrastructure. Challenges from a legal policy standpoint, in terms of what entity or what resolutions or official partnerships need to be put in place for the entity, whether it's a tribal public health department or healthcare organization implementing eCR. All those aspects often need to be formalized, and making sure you have the legal and policy expertise within your organization or um, uh, contracted to assist your organization will be key. And there are quite a few challenges that will be faced in terms of the geographical area that tribes may and TECs for that matter may be looking to carve out for their jurisdictional eCR reporting. These need to be carefully considered. What areas should be uh, included in the data, how those will fit in with the zip code structure and RCKMS. All those are important considerations that need to be thought through carefully. And then we talked about sustainability. As far as successes around eCR, we are thankful that we've had partners that have had pilot projects implementing eCR, and we were able to just gauge a lot of the success stories of eCR implementation. And one resounding aspect was the improved partnerships that implementing eCR was able to garner for a lot of tribes and tribal organizations, just within institutions and even with local and state entities. eCR by nature is a project where just by the process itself, it allows for strengthening of IT and public health infrastructure. It also allows for increased visibility of tribal public health efforts, just with greater access to data, and which leads into increased tribal data sovereignty and ownership of data and ownership of what is done with the data for public health action. Next slide. So I just wanted to talk about some of the next steps for NIHB in supporting eCR for tribes and TECs. We're planning to support 3 tribal public health authorities to directly connect to eCR in 2025, this year, and support 2 tribal public health authorities to strengthen an existing indirect eCR connection through either a state or local partnership. So that funding, that RFA is currently out, and we are actually having an informational session on the funding opportunity next next Wednesday, January 15th. So hoping to see many of you there who may be interested in applying for that funding. And then in partnership with NIHB, we are supporting urban Indian health organizations and connecting to eCR for healthcare providers. And I think we do have 1 or 2 of our partners from NIHB on the call today. So happy to have you join us. And finally, we are planning to develop 2 supplements to the eCR roadmap that we've already released. We plan to develop a guide for tribes and TECs to develop and leverage an indirect connection to eCR through state and local partnerships. And we are hoping a lot of what we learn from the authorities that partner with state and local health departments through the current funding opportunity can provide us with that information we need to put together that supplement for the eCR roadmap. And then finally, the work we're doing with NIHB with the urban Indian organizations, we're hoping that that can inform the supplement that we plan to have for this eCR roadmap in the very near future. Next slide. All right, and we did talk about some of those funding opportunities. So you can download and review the eCR roadmap that we've been discussing today via this link or by scanning the barcode. You can apply for the NIHB funding opportunities. You can access those through our website. You can click on this link, or you can go ahead and register for the eCR funding opportunity webinar, which will provide you with more information, which the link has been provided in for all of you to click on. Next slide. And I'd like to thank everyone for being a part of this session today. We wanted to allow enough time for questions that anyone may have for clarification on any of the components of the eCR roadmap or just eCR in general. I will open it up. Sarah?
And I think we have a few questions in the chat that we can start with, and then we'll open it up, and you can also unmute however you feel comfortable asking questions. So the first one is from Nicholas Hill. I heard you said there was an alternative to setting up triggering and or sending by zip code. Could you discuss this further and if it's being planned? Feel free for CDC folks to jump in as well. I wrote a quick answer in the chat, but there are discussions because sometimes zip codes do overlap. Sometimes we know with text, zip codes are really complicated. So there has been discussion about tribal enrollment being a field. It is set up to be a field starting next year. There's still discussion happening with the CDC Tribal Advisory Council, but it is technically possible to do that. And then I know that our partners had various ways to address this as well in terms of zip code. And I'll open it CDC if any of you, I think maybe just Sarah's on this call, if you have any other thoughts about answering that question.
Hi, Sarah. Thanks. Melinda Thomas also is on the call. She's our public health agency support lead on the CDC ECR team. So by the end of, I guess, this year, 2025, the EHR products, electronic health record products, will have um, to be certified by the Office of the National Coordinator. They'll have to meet the 3.1 version of the electronic initial case report template, and that has tribal enrollment status and tribe. I have the HL7 um, data set. Those are part of that new kind of template for the electronic initial case report. So, we don't yet know, how it will be used, and who will be filling it out and things like that. But at least it's kind of it will be an option for use. And then I think we're working to kind of figure that part out after that.
And then the next question from Miriam: for tribes who utilize IHS electronic health records or systems be able to participate in this? Partially answered this, but you can connect. If you're using IHS electronic health records, you can still connect to electronic case reporting directly to receive data. I will say that the IHS electronic health record system, RPMS, does not report. There are hopes that the new system will be reporting into EHRs, but will be reporting into AIMS. The EHR will be capable of doing that, but the current RPMS system does not. And I'm sorry, I thought that question, I think I had answered as if it was for the second. For the second opportunity, anyone who receives case report data from any partnership can participate in that second opportunity. But you must already be receiving at least some case report data. Does that fully answer that question, Miriam, if you're on the call?
Yes, it does partially, but I do have a question, a follow-up question to that. So, and I think this is where my understanding is a little bit, I guess I need a little bit more guidance on that. So if we have gone into self-governance in the area of healthcare, but again, we're still utilizing the IHS system, how does that affect? Would it fall into the first scenario that you mentioned or the second?
So the electronic health record system is what reports in, and then case reporting is what you get out. So what we're talking about is reporting in, and if you'd be able to get that data back out. If you're using the IHS current electronic health record system, that will not report into the AIMS platform. So you will not be able to get that data out. That being said, if there's other healthcare systems that your citizens use, you can still connect to eCR and you will get that data. And the process of setting up eCR also involves setting up requirements for reporting. So while you can't get the IHS data necessarily directly, you can still set legal requirements for them to report. And then the system, they will have to report through alternate methods. So things like fax, email, phone, secure email, phone, however you require them to report data. So you can still set up the system and start getting data, even if you're not going to get data from everybody where tribal members might seek care. Does that make sense?
Yes.
Yeah. So yeah, so that would be the first scenario. The second scenario is generally for tribes or tribal epidemiology centers that have partnerships with states and locals, where the states and locals are sending them the data that's being reported through the AIMS platform once they receive the case reports. So a lot of times those tribes have access to the surveillance systems that the state uses as a partner, and they can access the data that way. So they don't necessarily need a direct connection.
Okay, and so we were kind of a unique situation. So if we're in one state, but our TEC is in another state, and then we have a local public health department,
Yeah.
would then the part, I guess what I'm understanding is maybe the partnership would need to be with our local department and our TEC?
Yeah,
I mean, if they're in two different states?
Yeah, it depends on kind of who does the reporting. Every state and local kind of has a different system.
Right.
So you would have to kind of get a sense of who's getting that data. But if you connect directly, that data, doesn't matter what state the data is, as long as the patient lives within the tribal boundaries, you will get that data. Even if they seek the care in out of state, or the tech also gets the data. The techs are a little more complicated because their jurisdiction is wider and also dependent on which tribes they partner with. So it's a little more complicated for techs getting that data.
Okay, so that would mean like if we were to establish these guidelines, right, these requirements, then we would, then like the other entities or other healthcare organizations within our area would then, that's what would set that tone for reporting to the tribe.
Yes, yeah,
Okay.
any patient that lives on the tribe, even if they seek care at another health organization, you will get that data. As long as that health, I should clarify, as long as that health organization is set up to report into the electronic health record, or is their electronic health record system is set up to report to AIMS. Not every system is set up even outside of just the tribal systems.
Okay.
But that's part of the partnership aspect of this, is finding out, are the systems in the process? Do they need help getting started with the process? But they are still required to report to you whether or not they're in the electronic health record system. They may just need to use alternate reporting as long as you provide some sort of reporting requirements legally.
Okay, thank you. I think I got everything, but I may have missed some stuff. But thank you. I'm glad there's a recording. Can go back. Thanks.
Of course. And we'll share our contact information at the very end of the call. But if anyone on this call ever needs to just talk to myself or Sophie or the CDC folks, we are happy to have a one-on-one conversation with anyone to talk through this more, because our goal is to support not only the tribes that are, going to be funded through this, but all tribes that are interested in this.
Wonderful. Thank you.
Nice. Let me just see if we have any more questions to the chat, and then we'll open it up. Would you be able to provide an estimate of the overall cost of this? Also, for those that may not need funding, would the tribal public health authorities still be able to participate? The overall cost has a lot of factors that go into it. We can share how much the cost may have been to prior tribes that have done this. We are expecting that this cost is going down now that the eCR roadmap is there. A lot of those pieces are a little easier. We are providing $200,000 for tribes that are directly connecting for the setup. There are sustainability costs, and those kind of depend on how many cases you're getting, what surveillance system you're using. For if you're getting only a very small number of cases, you may not need so complicated of a system for storing your data, so the cost might be lower. So there's a lot of factors that go into this, but I think if you want to touch base with us one-on-one, we can try and help with that. And yes, even if you are not getting funding through NIHB, that does not mean that we will not provide technical assistance to you, or that you cannot go directly to CDC and connect. The eCR roadmap will give you guidance for exactly how to do this. So we have funding to support approximately 3 tribes a year right now. We hope that this roadmap will mean that well more than 3 tribes and tribal organizations a year will be able to connect, and our funding will be able to help support tribes that might need an initial financial support. But we don't want that to be the only tribes that are able to connect. So yes, you can directly contact CDC and get involved and start to connect. And we are happy to provide technical assistance to you at any time, whether or not you are part of the cohort. Okay. So I see a question from Chris Alabrande. For tribal affiliation for zip code, the person reporting the disease or condition would need to have collected the information on the patient's tribal affiliation, right? So if that's not in the system, it will impact the completeness of the data reported on, right? Okay, and Sarah, do you want to read your answer out loud just so everyone can?
Oh, I have to scroll up. Oh, I agree. Yes, Chris is right, as usual. But also wanted to note that it's tribal affiliation and membership status is set up as an optional data element in the 3.1 standard. So it's not going to be required for data completeness, at least according to the standard. It's possible that some states or other entities might decide that it's required for them. But that's kind of projecting out into the future.
And I think our last question in the chat, you mentioned that eCR could be sent up to 2 public health authorities, the patient's resident and where the care is received. Are there limitations? Sarah and Melinda, thank you for answering that in the chat. The answer was, I think I misspoke. There were 2 examples of types of ways it could be sent. So there's no limit on how many public health authorities it could be sent to. It will always be sent to the patient's residence, which may overlap with more than one public health authority. And then there also will be sent to where the patient received care. So if the state and the tribe, or the tribe and the local, have overlapping jurisdiction, one authority receiving it will not keep another authority from receiving it. Does that fully answer the question? I know they did a much better answer in the chat than what I just said. Okay, any other questions? Feel free also to unmute. You don't have to use the chat. Okay, I'm not seeing any other questions. So I am going to just pull up our contact information. Oh, I was incorrect. I don't have our contact information. And that I will send our contact information in the chat to everyone, and we will have it in the slides that we send out. Oh, I see a question. How will we receive or have access to the recording? NIHB will post it on our YouTube channel within the next few days. And also it will be sent out to everybody that signed up for this call, both the actual slides and the recording. And I'm just writing my contact info. So if you do want to write your contact information so I don't spell your email wrong.
Sure.
Or your phone number. Yeah, and please feel free to call us. The goal of this is really to create an interactive learning community. We're all new to this. This is a new process. So there's only been a couple of tribes that have gone through the process. I think there's going to be continuous learning, but we're really, really excited for this roadmap, and I hope that it will be a really useful resource. And please, as you're using the roadmap, give us feedback on what would be helpful. You can email or call me or Sophie. But we really want to continue to adapt this. We're viewing this as a growing learning document. So we hope that we'll be able to continuously update it as we learn more about how this looks and as more and more tribal organizations engage in this process. Great. Thank you, everyone.